Shingles. Shingles is a viral infection that causes a painful rash. Shingles can occur anywhere on your body. It typically looks like a single stripe of blisters that wraps around the left side or the right side of your torso. Shingles, also known as Herpes Zoster, is a viral syndrome caused by reactivation of the varicella-zoster virus. Herpes zoster typically occurs in adults or elderly. Shingles, Herpes Zoster, causes an outbreak of a painful rash or blisters on the skin. The rash most often appears as a band of rashes or blisters in one area of your body. After an episode of varicella, chicken-pox, the varicella-zoster virus remains dormant in the nervous system. The virus remains dormant in the sensory ganglia of the cranial nerve, or the dorsal root ganglia after a previous varicella infection. When you have chickenpox as a child, your body fights off the varicella-zoster virus. Then the physical signs of chickenpox fade away, but the virus always remains in your body. In adulthood, sometimes the virus becomes active again. This time, the varicella-zoster virus makes its second appearance in the form of shingles. Varicella-zoster is part of a group of viruses called herpesviruses. This is the same group that includes the viruses that cause cold sores and genital herpes. As a result, shingles is also known as herpes zoster. But the virus that causes chickenpox and shingles isn't the same virus that causes cold sores or genital herpes. Genital herpes is a sexually transmitted infection. It is believed that zoster occurs due to the failure of the immune defense system to control the latent replication of the virus. The incidence of herpes zoster is strongly correlated to the immune status. Individuals who maintain a high level of immunity rarely develop shingles. The infection is not benign and can present in many ways. Even after herpes zoster resolves, many patients continue to suffer from moderate to severe pain known as post-herpetic neuralgia. About 1 million cases of shingles are diagnosed every year in the US. The risk of shingles increases as you get older, with about half the cases occurring in people over the age of 50. Shingles develops in about 10% of people who have had chickenpox at an earlier time in their lives. What are the symptoms of shingles? The early signs of shingles include enlarged lymph nodes, fever, chills, and headache, itching, raised dots on your skin and redness in that area, stabbing or shooting pain, tingling or burning feeling in or under your skin, upset stomach. Call your doctor quickly if you have any of these signs. There's no cure for shingles, but treatment can lessen the chance of complications. That includes pain that lasts after the rash is gone, called post-herpetic neuralgia. Who is at risk for getting shingles? People who have had chickenpox who are more likely to develop shingles include those with a weakened immune system, such as 1. People with cancer, HIV. 2. Organ transplant recipients. 3. Those receiving chemotherapy. 4. Persons over the age of 50. 5. Those who have been ill. 6. Persons who have experienced trauma. 7. Those who have had a serious physical injury. 8. If you take long-term steroids or other medicines that can weaken your immune system. 9. Those people who are under stress. But many people who get shingles don't fit into any of these categories. The chickenpox virus doesn't leave your body after you have chickenpox. Instead, the virus stays in a portion of your spinal nerve root called the dorsal root ganglion. For the majority of people, the virus stays there quietly and doesn't cause problems. Researchers aren't always sure why the virus gets reactivated, but this typically occurs at times of stress. Is shingles contagious? Yes. You can spread the varicella-zoster virus to people who've never had chickenpox and haven't been vaccinated. People with active herpes zoster lesions can spread VZV infection and cause varicella in people who have never had varicella or received varicella vaccine. Once varicella resolves, these people would be at risk of herpes zoster. The varicella-zoster virus is spread through direct skin-to-skin contact with the fluid that oozes from the blisters. Shingles is rarely spread by breathing in the varicella-zoster virus the way airborne viruses are spread. If your rash is in the blister phase, stay away from those who haven't had chickenpox or the chickenpox vaccine. And keep your rash covered. You're contagious until all of the sores have crusted over. Until then, avoid pregnant women who may not have had chickenpox or the vaccine, people with weak immune systems, and newborns. Clinical features of herpes zoster. People with herpes zoster most commonly have a rash in one or two adjacent dermatomes, localized zoster. Dermatomy is an area of skin supplied by nerves from a single spinal root. The rash most commonly appears on the trunk along a thoracic dermatomy. The rash does not usually cross the body's midline. Less commonly, the rash can be more widespread and affect 3 or more dermatomes. This condition is called disseminated zoster. This generally occurs only in people with compromised or suppressed immune systems. Disseminated zoster can be difficult to distinguish from varicella. The rash is usually painful, itchy, or tingly. These symptoms may precede rash onset by several days. Some people may also have headache, photophobia, sensitivity to bright light, and malaise in the prodromal, early symptom, phase. The rash develops into clusters of vesicles. New vesicles continue to form over 3 to 5 days and progressively dry and crust over. They usually heal in 2 to 4 weeks. There may be permanent pigmentation changes and scarring on the skin. The 3 phases of the infection include pre-eruptive stage, presence with abnormal skin sensations or pain within the dermatomy affected. This phase appears at least 48 hours prior to any obvious lesions. At the same time, the individual may experience headaches, general malaise, and photophobia. The acute eruptive phase is marked by the vesicles and the symptoms seen in the pre-eruptive phase. The lesions initially start as macules and quickly transform into painful vesicles. The vesicles often rupture, ulcerate and eventually crust over. Patients are most infectious in this stage until the lesion dry out. Pain is severe during this phase and often unresponsive to traditional pain medications. The phase may last 2 to 4 weeks, but the pain may continue. Chronic infection is characterized by recurrent pain that lasts more than 4 weeks. Besides the pain, patients experience paresthesias, pricking, shock-like sensations, and dysesthesias, burning, itching, painful. The pain is disabling and may last 12 months or longer. Complications of herpes zoster. The varicella-zoster virus is responsible for outbreaks of a condition called shingles, mostly in older adults. The virus also is the cause of chickenpox, and once infected with chickenpox, the virus remains dormant in the body for years. It reactivates if the immune system is weakened, attacking the nerves feeding the skin. The result is a painful rash of small blisters in a defined area. The pain and blisters can persist for months and even years, leading to possible nerve damage and scarring. Vaccine. There is no cure, but there is a vaccine that may prevent shingles. Shingles can have complications that last long after the rash is gone, including 1. Brain inflammation or facial paralysis if it affects certain nerves. 2. Eye problems and vision loss if your rash was in or around your eye. 3. Pain that lasts long after the outbreak, called post-herpetic neuralgia. It affects up to 1 in 5 people who get shingles. 4. Shingles oticus is also known as Ramsay-Hunt syndrome type 2. It is due to the spreading of the virus from the facial nerve to the vestibulocochlear nerve, which involves the ear. It causes hearing loss and vertigo, rotational dizziness. 5. Zoster may occur in the mouth if the maxillary or mandibular division of the trigeminal nerve is affected. Clinically, it presents with vesicles or erosions. It occurs over the mucous membrane of the upper jaw, palate, gums of the upper teeth. It can also occur over the lower jaw, tongue or gums of the lower teeth. Oral involvement may occur alone or in combination with the lesions on the skin over the cutaneous distribution of the same trigeminal branch. There is a close relationship of blood vessels to nerves. Therefore, the virus can spread to involve the blood vessels, compromising the blood supply, and causing ischemic necrosis. Complications such as osteonecrosis, tooth loss, periodontitis, pulp calcification, pulp necrosis, periapical lesions, and tooth developmental anomalies can occur due to it. 6. The ophthalmic division of the trigeminal nerve is the most commonly involved branch, which causes ophthalmic zoster. The skin of the forehead, upper eyelid, and orbit of the eye may be involved. It is seen in approximately 10% to 25% of cases presenting with features of keratitis, uveitis, and optic nerve palsies. Complications in the form of chronic ocular inflammation, loss of vision, and debilitating pain can occur. 7. The involvement of the CNS is not uncommon. Since the virus resides in the sensory root ganglia, it can affect any part of the brain. It causes cranial nerve palsies, muscular weakness, diaphragmatic paralysis, neurogenic bladder, Guillain-Barré syndrome, and myelitis. In severe cases, patients may develop encephalitis, inflammation of the brain. Post-herpetic neuralgia. 8. Post-herpetic neuralgia, PHN, is the most common complication of herpes zoster. PHN is pain that persists in the area where the rash once was for more than 90 days after rash onset. PHN can last for weeks or months, and occasionally, for years. A person's risk of having PHN after herpes zoster increases with age. Older adults are more likely to have longer-lasting, more severe pain. Approximately 10 to 13% of people 60 years and older with herpes zoster will get PHN. PHN is rare in people younger than 40 years old. Other predictors of PHN include the level of pain and the size of rash. The sum up of the complications of herpes zoster includes ophthalmic involvement, herpes zoster ophthalmicus, with acute or chronic ocular sequelae, including vision loss, bacterial superinfection of the lesions, usually due to Staphylococcus aureus, and, less commonly, due to group A beta hemolytic streptococcus, cranial and peripheral nerve palsies, and visceral involvement, such as meningoencephalitis, pneumonitis, hepatitis, and acute retinal necrosis. People with compromised or suppressed immune systems are more likely to have complications from herpes zoster. They are more likely to have a severe, long-lasting rash and develop disseminated herpes zoster. Can you get shingles more than once? Yes, you can get shingles more than one time. One of the biggest myths about shingles is that it can only happen once. This isn't true. You can have more than one episode. If you get shingles again, you usually don't get the rash in the same place. How is shingles diagnosed? Shingles can be diagnosed by the way the rash is distributed on your body. The blisters of a shingles rash usually appear in a band on one side of your body. Shingles also may be diagnosed in a laboratory using scrapings or a swab of the fluid from the blisters. Prevention of shingles. A shingles vaccine may help prevent shingles. People who are eligible should get the Shingrix vaccine. It is available in the United States since its approval by the Food and Drug Administration in 2017. The Zostavax vaccine is no longer available in the US, but other countries may still use it. Shingrix. Shingrix is approved and recommended for people age 50 and older, whether they've had shingles or not. People who've had the Zostavax vaccine in the past or don't know whether they've had chicken-pox may also receive the Shingrix vaccine. Shingrix is also recommended for people who are 19 years of age and older who have weakened immune systems due to disease or medication. Shingrix is a non-living vaccine made of a virus component. It's given in 2 doses, with 2 to 6 months between doses. The most common side effects of the shingles vaccine are redness, pain and swelling at the injection site. Some people also experience fatigue, headache and other side effects. The shingles vaccine doesn't guarantee that you won't get shingles, but this vaccine will likely reduce the course and severity of the disease, and it will likely lower your risk of post-herpetic neuralgia. Studies suggest that Shingrix offers protection against shingles for more than 5 years. Talk to your healthcare provider about your vaccination options if you 1. Have had an allergic reaction to any component of the shingles vaccine. 2. Have a weakened immune system due to a condition or medication. 3. Have had a stem cell transplant. 4. Are pregnant or trying to become pregnant. The shingles vaccine is used only as a way to prevent shingles. It's not intended to treat people who currently have the disease. Treatment for shingles. Antiviral drugs can help you heal faster and cut your risk of complications. They're most effective if you take them within 3 days of the start of a rash, so see your doctor as soon as possible. You'll probably get one of these 3 medications to fight the virus. 1. Acyclovir, Zovirax. 2. Famciclovir, Famber. 3. Valacyclovir, Valtrex. Treatments for shingles pain can include A. Anticonvulsant medicines like gabapentin, Neurontin. B. Antidepressants like amitriptyline. C. Colloidal oatmeal baths. D. Cool compresses. E. Medicated lotion. F. Numbing medications like lidocaine. OTC. G. Over-the-counter drugs like acetaminophen or ibuprofen. H. Prescription painkillers like codeine. Most people who get shingles only have it once. But it can come back, usually in people with weakened immune systems. How is post-herpetic neuralgia treated? Treatments include lotions or creams, such as lidocaine or capsaicin. There are other medications that are not specifically used for pain, such as antidepressants or drugs for epilepsy. Regular pain relievers are not usually effective for this type of pain. If your pain doesn't lessen, you might try therapies like nerve blocks or steroid injections near the area where the nerves exit the spine. Your provider might suggest an implantable nerve stimulator device for severe, ongoing pain that hasn't responded to other treatments. Is shingles dangerous or even fatal? If shingles involves your eye, it can lead to blindness. In rare cases, shingles can lead to hearing problems, pneumonia, inflammation of the brain, encephalitis, and even death. Why doesn't having chicken-pox earlier in life provide immunity against having shingles later? After having chicken-pox, your body doesn't rid your system of the virus. Instead, the virus stays in a portion of the spinal nerve root called the dorsal root ganglia. In most people, the virus simply stays there quietly and doesn't cause problems. Scientists aren't always sure why the virus gets active again, but they know stress can be a cause. Can you get shingles if you haven't had chicken-pox? No. You can't get shingles if you've never had chicken-pox, but you can get chicken-pox from someone who has shingles. If you've never had chicken-pox and you come into direct contact with the oozing, blister-like rash of someone with shingles, the varicella-zoster virus can infect you and you would develop chicken-pox. Once you've had chicken-pox, you could develop shingles at some point in your life. This is because the varicella-zoster virus never fully goes away after you've had chicken-pox. It lies quietly inactive in your nerve tissue. Later in life, the virus may become active again and appears as shingles. What is the difference between herpes zoster and varicella-zoster? Herpes zoster is simply another medical name for shingles. Varicella-zoster is the virus that causes both shingles and chickenpox.